We have discussed so much, and please reach out to Dr. DeNoble or your doctor if any of these things are going on. Dr. DeNoble is here in Ridgewood, right across from the train station, right by Whole Foods. And in Wesley Square? Is that what it is?
Wellesley Square.
Wellesley Square.
You know, it's right next to Carlos Bakery. Everyone knows Carlos Bakery.
Okay, Carlos Bakery.
So if you know Carlos Bakery, the cake boss shop, we're a couple doors from there.
Okay.
But you know, again, the main thing I want to just get across to everyone, if you're suffering especially from bleeding issues, it can be treated. And a lot of the treatments can be very simple with low risk and performed easily. You know, I have patients come in and they're just bleeding half the month. And they're anemic, like I mentioned, and they're tired from the anemia.
Right.
So you don't have to suffer through that. It can be treated in many ways.
That's wonderful.
You know,
and I was talking with someone yesterday. I just want to go back to the surgery and the polyps and all, because I know people are fearful of surgery. And that's not what they want to jump right into.
Of course.
But you are saying that it should be done.
Well, if you do have a polyp, or if the lining appears abnormally thickened, you will need the polyp removed or a scraping, a DNC, to remove the tissue, one, to stop the bleeding, and also to send to a pathologist to rule out anything. And these surgeries can be done under light sedation with local. You don't have to be put completely under. You know, if that's what people are fearful of. And they're low risk surgeries, and they're outpatient. The procedures take 30 minutes, 45 minutes long. And you go home the same day, and there's very minimal downtime after that. So don't shy away from it if you absolutely need it. You don't always need surgery. Many times you don't need a surgical procedure. But if there is an abnormality, you know, we do recommend taking care of that. You know, usually.
And what's the recovery on that?
For the DNC hysteroscopy procedure, removal of polyps, like I mentioned, you go home the same day. You don't have to spend the night in the hospital. You're there about an hour or two. And you may have some minor cramping, some light bleeding for a few days afterwards. But you can go to work the next day.
And it's normal also if you have polyps that you could have the irregular bleeding, heavy bleeding.
Absolutely.
But then it goes back to normal, right?
Yes. If that is the cause, it does resolve. Absolutely. Absolutely. Sometimes we do, you know, two things at one time. I've had patients where we remove the polyp, do a scraping, and then put in the Mirena IUD. You know, at the same time. They say, you know what, I want the IUD for the next 5 years to treat my bleeding issues and get me into menopause. So sometimes we do that.
Just to share with you guys, and I've also spoken with some other women, so this is why I'm going to have full disclosure here. I myself, you have found polyps, and I myself need that surgery. And the reason you did the test was because I had very heavy bleeding, to a point where it was almost, you know, I couldn't leave the house. It was so bad, because I wasn't sure how much blood. But I don't deal with that every month. Like it's you know, it's been a couple of times. And now I'm okay. But I'm sure it'll happen again at some point. And I know that I need to go in for the surgery. So I'm just saying that if you have the heavy bleeding and then all of a sudden a few months or several months you don't have the bleeding, there's still something going on. Because it's not normal for you to have all of a sudden very heavy bleeding. Right?
And again, my main concern as a physician is to make sure there isn't anything malignant or pre-malignant. You know, that's I like to check that off the list. Because God forbid there is something, you know, we want to catch it early and take care of it. So that is a big concern. You know, if your bleeding go back to normal, you can get a repeat ultrasound and check. Make sure there's still something there before rushing to surgery. You know, so if your bleeding patterns become more normal again, then you can get a repeat ultrasound and take a look again. To avoid that. Or to do the saline sonogram, as I mentioned, which even looks a little bit better. And you may avoid surgery.